Asthma is a chronic respiratory disease characterized by inflammation within the lungs, and it affects 25 million Americans, including 7 million children. Once a pediatric asthma diagnosis is made, physicians usually prescribe a treatment specific to the child's age. In general, for long-lasting preventative asthma medication, children ages 3 and younger are prescribed a nebulizer, children ages 4 to 6 a pressurized metered dose inhaler or PMDI with the spacer, and children ages 7 to 12 a dry powder inhaler or DPI. The problem is, nebulizers and PMDIs both have an array of issues relating to their size and method of activation, which make them impractical and hard to use. DPIs, on the other hand, are a very small and compact type of breath-actuated device, in which inhalation itself triggers the release of powdered medication. Due to the myriad of issues found with the nebulizers and PMDIs, coupled with the benefits of the dry powder inhaler, DPIs have become the fastest growing inhaler on the market, and have a compound annual growth rate of 5%. They've begun to transcend age boundaries and have become the preferred method of care for many asthmatics outside of the age ranges listed. With this being said, DPIs require inhalation flow rates of up to 60 liters a minute to ensure optimal particle dispersion within the lungs. However, children under the ages of 12 who are prescribed BAIs and DPIs generate on average 25 to 40 liters and cannot obtain the full dosage. At this flow rate, medication cannot be dislodged from the carrier particles in the inhaler, nor can it fully enter the lungs. Hence, we've identified that children with both asthma and low inspiratory flow need a method of ensuring sufficient drug delivery from their breath-actuated inhalers in order to reduce their exacerbations of asthma symptoms. To combat this issue, we've created a novel solution that's aimed at ensuring sufficient drug delivery. The proposed device, called FlowMate, is a small portable adapter that attaches to a DPI to facilitate dose intake. As the patient inhales through the adapter, there will be a pressure buildup that will automatically increase the inspiratory flow without any need for an external energy source. After inhalation is complete, an indicator button pops up and the patient must simply press down on a button to reset the adapter. This adapter can have far-reaching impacts not just on the health of pediatric patients, but also on the wallets of consumers. Currently, with the shortcomings in DPIs and the need for repeat dosing, between $170 to $354 million are lost in pharmaceutical expenditures every year. Additionally, millions more are shelled out for hospital and emergency room visits due to asthma-related cases. FlowMate will slash these costs drastically by reducing the need for repeat dosage and ensuring sufficient respiratory flow, so as to eliminate DPI-related hospital visits. With the shift towards DPIs in the pediatric asthma space, the glaring lack of a suitable device, and the hundreds of millions that are lost trying to mitigate the issue, there is a clear need for a device that ensures sufficient drug delivery from breath-actuated inhalers. FlowMate is that device.